Hi, I'm Rachel Blow, Head of Nursing and Professional Practice and leading the implementation of the Culture of Care standards at North Staffordshire combined as part of our inpatient quality transformation work. I really like this image from NHS England. I think on one page it summarises the 12 Culture of Care standards really beautifully and shows us what we need to be working towards.
So the Culture of Care is part of the NHS Quality Transformation Project, and it looks at improving the culture of mental health inpatient wards, learning disability and also autism wards to make them more kind of co-produced and better places to be.
So the Culture of Care is looking at 12 different standards which basically aim to make the ward environment more inclusive, more equitable for people, but also a fulfilling place for staff to work as well. And some of those 12 standards include looking at lived experience, how we encompass that on the ward, but also looking at safety, how does that feel for patients and how does that feel for staff as well, and giving everybody the opportunity to look at the things we could improve, but the things we also do really well already.
The community meetings are an opportunity for patients to come together with staff and discuss the topics that are on the agenda for the Culture of Care. It's to involve patients anyway, to make them, help them feel more involved in what goes on the wards, and help them feel empowered that they can change things for the better.
So within the meetings we look at each of the statements and we allow the service users to score how we're doing at the moment, but also we then review it later down the line once actions have taken place to see how things have improved. And we also do that with staff as well to get both points of view so it's more co-produced.
From a reducing restrictive practices side, I suppose that runs throughout the whole of Culture of Care, because one of the things it's looking at is improvement leadership qualities, compassionate leadership, working alongside staff, working alongside patients. And if staff are feeling well and patients are feeling well, they're less likely to use restrictive practices, things like restraint, rapid tranquilization, seclusion. And if patients are felt that they're being listened to, which they should be, that also improves the relationship between staff and patients, which again will have an impact on the reduction in restrictive practices.
The outcome of the Culture of Care is that there is a change in culture, and that change in culture ultimately is that it's more around co-production and lived experience, and actually the voice of the people who are really experiencing, whether that be the patient, the carers or the staff, but that their voice is heard, and that ultimately helps to change the culture.
There's room for improvement always, and the patients, if we listen to them and ask them the right questions, then we can find answers and solutions to problems that will make the ward a more therapy, recovery focused environment.
I think the hope is that we will continue to develop this practice where things aren't just decisions that we make in silo, that they're joint decisions that we make as a collective community. So involving service users, their carers and staff to make sure that the work that we do and the care that we deliver is tuned to the people that are receiving those services, and it's person-centred.
The future of Culture of Care is in our hands, and together with patients, carers and staff we can make a real difference. We look forward to keeping you updated on our journey.